I get it. I get it. No worries. Um, so I think we can begin. Um, okay, so welcome everybody to COVID-19 Conversations. These conversations take place every Thursday at 10 a.m. on Zoom. The conversations are brought to you by the African Alliance with support from the Department of Science and Innovation and the South African Medical Research Council. The conversations are also brought to you by the Vaccine Advocacy Resource Group, which is 100% funded by activists. These calls are brought to you in collaboration with the Community Constituency COVID-19 Front, the Treatment Action Campaign, and APHA. Today, we're speaking to Vanita Daniels, and we're going to discuss with Vanita Daniels some of the experiences that they have had working in the area of gender-based violence in the time of COVID. Um, I think we've seen news reports and data certainly coming out that really unpacks the importance of not losing sight of the range of existing pandemics that were in place even before COVID arrived. So, Vanita, the way we structure these calls is that we'll ask you to give us an overview of the work that you do, and we'll have a bit of a conversation afterwards. And that's how the call will go. Because we don't have participants on the line today, and this will be a recorded session that we will then promote on our social media platforms. There's a bit less pressure to answer immediate questions in the chat. So I hope it's a much more free-flowing discussion. So thank you again for your time and welcome. And if you could introduce us to yourself and the work that you do.
Thank you so much for the opportunity. It's always, I think we need to have gender-based violence as a constant topic of conversation in this country because honestly, our stats are just horrendous. So our organization is called Rise Up Against Gender-Based Violence. We weren't very imaginary with our name. It says exactly what we do. And so before COVID, most of our work was centered around women and gender non-conforming persons who live and work on the street. And so we provide direct support as well as support around advocacy, etc., for that particular demographic. When it comes to GBV, they are probably the most underserviced group. And so we felt that it was important for us as an organization to focus on them specifically. In addition to that, we also do behavioral change programs focusing on the youth and men in particular as well. And so that was basically what we did. Oh, and then we also do quite a bit of advocacy work. We work within various organizations and collectives such as the Call to Action, Asijiki, and so forth. And so during COVID, because our demographic was, according to government, in terms of the information that we received, they were going to provide shelter for people who are living on the street. And so we were, okay, we're not going to basically have to do anything as in direct work that we would be doing. And I think it was the first or the second day when government announced the GBV hotline. And so Mandisa, my co-director, we had a discussion and we were, but that clearly means that government doesn't know what GBV looks like in this country. We are essentially locking people up in their homes. And we know that for the most part, perpetrators are people that we know. Perpetrators are the ones who are in our homes. And so if your only recourse is for me to pick up the phone and call you, then you don't know what GBV looks like. Because how am I supposed to call you when the person who is busy attacking me and abusing me is in earshot of me? And we also know that the most dangerous time for victims and survivors is when they seek out help and when they want to leave. And so we decided to actually start an emergency evacuation service. And we then opened up, we created a WhatsApp line. We opened up all of our social media platforms. We then basically informed all of our networks, look, this is what we are going to be doing. And then we kind of learned through, you know, various interventions that would, how to kind of hone the service that we were providing. And so in addition to because one of the things that we actually discovered then was that food was being used as a means to punish victims and survivors because they did not have, they did not have the means. And so what perpetrators were doing was actually withholding food and things like that. And so we then included food parcels or grocery parcels and whatever other necessities survivors needed, because many times people left with just, the clothes on their back, if that much, because we had a survivor that the perpetrator made her take off her shoes because he bought for her. And we were there and he made her take off her shoes. And so what the service looks like is we are contacted either by friends or family, or the survivor themselves. And then we arrange what would be a good time for us to come and pick them up. And we would then activate the police service, who would then accompany us to the home. And we would then go there and help the survivor pack, and then take them to a shelter or a safe space that they had identified. And so, and then in addition, we would then give each survivor, enough groceries to last at least 2 to 3 weeks. We would buy clothes, we would assist with whatever basic medical supplies that they needed. So it was a lot. It was everything. I mean, we were so surprised when one of our survivors, so we chatted him via WhatsApp, and so one of the survivors, after we had arranged we were going to come and pick them up, they sent us a message and they were like, can I bring my hamster, please? And so we were, okay, so there's pets as well. So, and I remember Mandisa said, what is a hamster? I'm like, oh my God, it's a rat. It's like a private school rat. And so it was just, we were learning as we were going along. But one of the things that really struck out for us was how the current system that we have is so broken. Because there were some survivors that wouldn't leave for legitimate reasons, because one of the survivors asked us, well, what happens to all of my stuff? Do you come and take my stuff as well? And we were like, we're not a moving company, so we can't obviously offer that service. And where are we going to take it? Because the shelter is not going to accept it. And she was, but what happens to me, pardon, what happens to me after my shelter stay? And that's one of the big questions that we need to answer. And also there were problems with shelter placements. We had a lot of undocumented migrants and foreign nationals that we needed to assist. And so it was a problem getting those particular individuals into shelters as well. Obviously with COVID, it became, because there was a time frame, and so shelters didn't have space to isolate people, and the rapid tests were not available, and it was just a nightmare. We were, I think, as a country, as a sector, wholly unprepared, particularly for a pandemic like this. And then in addition to in addition to the evacuation service, we then also provided food aid, and that was a big problem during COVID, particularly for undocumented foreign nationals. We did quite a bit of work in the CBD areas of Pretoria and Johannesburg, where we actually provided food, we provided supplies for them to be able to do basic cleaning, like buckets and water containers, and supplies to be able to cook, etc., etc. It was a lot of things that people needed and still do, in fact, because that particular demographic is unable to access government services. For instance, they couldn't access the 350 rand that was provided by SASSA, Department of Social Development. So it was a big problem.
Yeah, it sounds like, I know at the beginning of the pandemic, a lot of us were talking, at least if we weren't talking, we were thinking perhaps that, there might be a lessened workload. But I think very quickly we realized that quite a lot of us have never been so busy in our lives.
Exactly.
It just felt like a tsunami hitting us. but you've touched on food support, on security, on shelters, etc., etc. And I think I would be amiss if I didn't speak about the elephant in the room that has been in the room for what feels like forever. And I'd love your thoughts and your perspectives on it. And that is the strategic plan, the what has been called publicly the GBV NSP. Where does Rise Up locate itself in that landscape? Do you believe that this document, after years and years, and I think over 10 years ago, I did some work on it at Sonke when we were doing the costings with KPMG, and it's just been around forever. And the packaging of it was, oh, well, look at the success, and even that's debatable, that the National Strategic Plan on HIV has had. And so if we want success in GBV, we should do a national strategic plan. And of course, the argument was that because an NSP will not only be strategic, but it'll also come with an implementation plan and a budget, then it would give us the best chance at making an impact. So can you just share some of your thoughts on, number one, where we are at the moment? And do you think that such a plan in its current formation, where it's currently situated politically as well, should we be rallying behind this plan and giving it everything we've got, or have we perhaps gotten this one spectacularly wrong yet again?
You, that's a loaded question. So as Rise Up, we were part of the sentence shutdown. We were part of the total shutdown. We part of Call to Action, which actually, called for something for government to do in terms of this crisis, and the NSP was one of those. I'm not too sure in terms of, so we support broadly the idea of an NSP. And so in its current form, there has been challenges, particularly with, I think it was the trust that needed to be set up, et cetera, et cetera. And we had actually called for government to stop that process because we just felt that it wasn't the correct way to do things. As Rise Up, we were part of the Call to Action that actually ran a 12-week online sort of workshop around the NSP in terms of how it started, what was our involvement, what does it mean, the various pillars, etc., etc. The thing for us really is we need to be practical, and that has been one of the major gaps. And so personally, I mean that money is not the problem. It's in terms of how we actually allocate those resources and allocate those people. And so you find that, for instance, when we had there was a 1.6 billion rand that was, made available, organizations had to apply. And so what happens is that what happened in that process, particularly because of the way in which the application process was structured, a lot of organizations that work on the ground and that provide direct support and do amazing work are unable to apply because government processes makes it extremely difficult for certain organizations to do the work that they want to do or can do without the funding that they need. And so that basically is our position in terms of it needs to be practical. We definitely need, and you're right, it's debatable in terms of, how effective these plans are, because one of the things that we have in this country is we have beautiful policies, we have beautiful plans, and then we make a big hoo-ha about releasing and presenting it to the world, but when it comes to implementation, that's where we fall short. And so we need to look at all of the various elements within the system. So if we look at the shelter system, for instance, what is the kind of support that we need? If we look at the Tutuzela care centers, what is the support that we need? If we look at court support, if we look at the criminal justice system, except we have horrendously low rates of prosecution, never mind prosecution, even just cases that go to court. We victimize the survivors and the victims, we re-victimize them through the court system. And, you know, it's, I don't want to sound as if I am, what's the word? Defeated, you know, but it is a lot of work that needs to be done. And I just don't think that it's these days it's politically correct to say I am, you know, gender-based violence. Everybody talks about gender-based violence. We're ending 16 days of activism, you know, and so we have this kind of yearly sort of trope where we just kind of, everybody lines up and we do the same thing over and over, and our numbers keep rising. So obviously we are not doing something right. We just actually, as an organization, we just came back from doing tavern dialogues, which we've done in Gauteng and in the Western Cape at the GBV hotspots, and even those GBV hotspots in inverted commas because of the way in which those hotspots were identified. And it was, at times, it was extremely challenging having the conversation with men around GBV. But there's so much work that needs to be done, and we can have as many NSPs as we want, but if we're not going to change the behavior and the mindset of perpetrators and survivors and victims, we're not going to make a difference. That's what I feel.
Yeah, thanks for that. I mean, I think I really appreciate your reflections, especially on the Tavern program, which certainly, you know, it caught my interest when I saw it. Apart from the great pictures on Facebook, I was particularly interested in seeing the responses from activists and from some sectors of civil society. It really struck me as interesting, to be very diplomatic.
Yeah, we got a lot of
It's
flack.
interesting to see the responses, and I couldn't help but wonder, as someone who dipped my toe into the engaging men and boys space and decided very quickly, this is not for me, it's not my struggle, I have no interest, and I just don't want to use my time on this because I don't believe that we have a model yet that is going to give us the change. I mean, we've been engaging men and boys forever. We've been looking for this mysterious new man in South Africa. We've been looking for this pervasive brother for life. We've been looking for all of these things. And it's really interesting to see where are they and perhaps where are they not. And I just don't think we've done enough hard
Yeah.
intellectual work to really
Yes,
just
no.
understand where have we gone wrong. I mean, I think if I won the lottery, I would immediately put some of that money into literally 0 to 5-year-old boys. I feel that, you know, after that, good was for the rest of you, but I feel the bus has moved on. We literally have to be looking at 0 to 5. But anyway, that's just some rambling.
Yeah, no, the Tavern Dialogues was really, I think, one of the interesting things for me. Because we did get a lot of flack from activists and within our sector. There were obviously mixed responses. One of the very interesting things for me, and I still need to kind of grapple and work through my thoughts and sort of kind of pen this, because I just don't have all of the words to describe what I saw. But so we constantly have this idea that men and boys have what we call locker room conversations, right? And so we need to get into those conversations so that, you know, we can sort of like direct them, kind of thing. And the interesting thing for me with all of the conversations that we had was how shocked the men in the room were when men would say things that we know as activists in the space, they say to us all the time, you know, and as victims and survivors, they say that to us all the time. And so other men were completely shocked. They were like, dude, you can't do that. You are a rapist. And so it clearly, it showed to me, you know, and that's obviously, you know, I mean, it's only 20 Tavern Dialogues that we did, but it shows to me that the locker room conversations that we think men are having is not the locker room conversations they are having. because they're not having hard conversations. For instance, one of the topics that we discuss is stealthing. And the way in which it was such a mixed bag, like there were men that were like, no, that's rape. And then other men were like, no, that can't be rape. And we would have long debates and conversations about that. And so the way in which we structure the conversations is that the men would be talking to each other, right? So we did very little talking. We basically just kind of structured the topics and things like that, moved them in a certain direction, that these are the things that we want to talk about. And so I have this thing where I talk about palatable victims and survivors and sort of palatable perpetrators. And so we have this, so for instance, when we say things like real men don't rape, we're like, okay, so I was raped by a fake man. So, you know, those problematic statements, like, so what does it mean to be a man? Do we even have to use those terms? Because still we're having all of these binary conversations around men and women. And we had it was quite enlightening to see when the light went off in somebody's eyes, you know, went on in somebody's eyes because of the engagement that they were having with their peers. And so we've spoken about this, Mandisa and myself, in terms of, because we've got quite a bit of data as well, and we're also doing some monitoring and evaluation in terms of how do we structure programs that deal particularly with men and boys that will actually give us the kind of benefits that we need. Because there were men who spoke, like we had 3-hour dialogues at each tavern. And there were some taverns where we spent 5 hours because the men would not let us leave because they kept talking and talking and talking and talking. And so there's definitely a need for this kind of work, but you are right in terms of how do we structure those engagements to actually give us the kind of results that we need. And I think one of the most interesting things for me was how, by and large, men just refuse to connect the dots. Like they recognize their behavior, but they don't recognize that their behavior leads to these things. So we have discussions. So we discuss patriarchal norms, for instance, but we obviously don't use that terminology. So we discuss gender roles, but we just ask them, like, what do you do in the house? What do you do in society? And then we talk about, okay, what do women do, etc., etc. And so without fail, men have this opinion that women are currently ruling everything. Women have so many rights. Women have, women are just getting everything, and they are currently the victims. And so we have a male facilitator that does that, where we try and connect the dots. And so he asks a question after we've gone through this entire process where men are like, women get everything, women are the best things in sliced white bread, etc., etc. And then he says, okay, so we all agree that women have it good, right? Men are being, victimized, and it's a horrible thing to be a man right now. So tomorrow, if you die and you get a chance to come back, will you come back as a woman? No, never. And then we're like, okay, but how do you like
the same women who have it so good?
Yeah, so you don't like, so we're just like, okay, but you see that this is happening, right? But it was good. Honestly, I really felt, there were some times when I really felt a lot of empathy for men. Because patriarchy is really giving men a hard deal, especially now during COVID, when a lot of men cannot be providers. And so that has been one of the main issues that came out in our dialogues, that, yeah, my partner's not treating me right, I'm like a second-class citizen in my house because I can't, I haven't been able to provide. And so we're like, yes, but you structured your entire manhood around, I am the provider. And so this is the result of you doing that. So if you can't provide, and this is who you say you are, then what are you? So it was quite interesting. And I think we're going to continue, although it was very, very, very hard. We had some harrowing incidences. But it's also a very, it's an interesting demographic. I think with our last our last batch of, the men were also very different from the Western Cape to Gauteng. There was a lot less. In Gauteng, there was quite a bit of men trying to engage with us. You know, kind of sweetie pie this and sweetie pie that. In the Western Cape, not so much. But they were extremely, I think there was a lot more anger in the Western Cape from the men. They were very, very, very angry. And in Gauteng, not so much anger as the flirting and the, you know, trying to grab us and things like that, which we knew was going to happen. And they kind of, I was like, they had to protect me a little bit. I was singled out by old men, like it was the most amazing thing. The oldest of old men would be like, but they were, I guess, yeah, it was horrendous at times.
That's really interesting, and I'm wondering, to bring it back home, how many of the activists who gave you so much flack around that work, would they have still given you that flack if they had really understood the richness and the just the energy, the personal energy that people brought to these discussions? Um, and before we move on to some other questions, I just wanted to get your thoughts on, what do you think gets us all agitated when we see groups like Rise Up, or even, you know, groups like Sonke Gender Justice, or a range of groups who work with men and boys? What do you think is behind that annoyance? Like when we see that, just immediately, you know, you just get nar. You be like, you know, focusing on men, why are they doing it? And I guess in part it's because we don't have that model that works, and we've been trying for years and years and years. But what do you think we can do as civil society? And as I said earlier, I'm one of those who men. I get, you know, I totally get, you know, that women and queer folk and people who identify in different ways are not assaulting themselves. They're not, you know, and we have to engage men and boys at some stage. What do you think is one of the most strategic things, if money was not an issue, where would you put that money in terms of maybe even going beyond engaging and really just dealing with the issues of men and boys? Do you think we've engaged? And do you think that is the problem, that we're in this endless cycle of engaging and then what? What are your thoughts on that?
I think that I would probably agree with you in terms of the age group, like 0 to 5, and, you know, kind of focus there. But it's such a multifaceted, you know, problem that needs to be addressed because it's a societal problem. And I know that we don't really, and I'm going to say something that's probably going to get me into trouble, but we need to do a lot of work with women as well. And I know that because, and so I'm kind of trying to grapple through my thoughts so that I don't say really horrible things. But honestly, from the engagements that we've had, I honestly feel that we cannot stop having those engagements. I think that one of the reasons why people are so, you know, activists in the space and society in general kind of have this idea that we've been working with men, you know, I don't want to do this work. I think what's behind that also is that men, by and large, perpetrators by and large, seem to feel, what's the word I'm looking for? There's no acknowledgement of the problem from men, because there's, like, when we talk about real men don't, when men talk about our woman we need to protect, they don't see a problem with that. And so when you ask them questions like, okay, so if it's not your mother or your aunt or your sister or your daughter, so I can just be raped, I can just be beaten up because I don't belong to you. And so we need to really try and unpack patriarchy, because that's where the root cause of this problem is. And it's a massive thing to say, okay, well, we need to dismantle patriarchy. And so, but where do we start? And I honestly feel like this is things that we need to incorporate into our education system. But that is such a minefield. Trying to do what was this thing that we were trying? I just call it sex education, but it's not sex education that we're trying to introduce.
Education, CSE.
Yes, yes. And then, people lost all of their minds. We were trying to teach young children about consent as a basis, like, this is my body and I don't consent to this. And,
Their mind,
teach.
CSE is promoting sex among kids.
Yes. And so when we have, so we can't even begin to dismantle patriarchy if we can't even have basic conversations with children. And children are amazing. They're absolutely amazing. And they have the tools and the means to understand complex things, but we just need to simplify it for them. And so you can have discussions around patriarchy with children. And I think that we need to start there. And so I don't want to say, okay, well, I'm just going to give up on everybody older than, 7. Because I was very heartened by the engagements the feedback that we received from men. And we had one tavern dialogue where there was a gentleman who was busy talking about his partner abusing him. And he showed us, that she was stabbing him. He showed all of his marks and, he was crying in the session. And his friends were laughing at him. And so we stopped the dialogue and we were like, okay, but all of you were talking about how you don't have an opportunity to vent, you don't have spaces where you can talk. And here's your friend being vulnerable and saying to you that I am being hurt, I'm in pain, I need help. And your response is to laugh at him. But you are the same person that says when you go to the police station and you want to report your girlfriend beating you, the police laughs at you and you have a problem with that. But you are the one laughing at your friend. So we don't do that. And so we had a discussion around that. And the saddest thing, because we've created WhatsApp groups for each tavern, so we have discussions and engagements with them post the tavern dialogue. And his girlfriend killed him like 3 weeks later. And it was so sad when the men in the group were talking about it. And the one gentleman was saying, I honestly feel really, really bad because I was one of the guys that was laughing at him and I should have been offering help. And so then they had a conversation like, guys, we need to help each other. We need to, be there for each other. If you have a problem, you must talk. So it's very heartening that once you've given men that space to talk and because it's important to just, vent. It's important to let out that's inside so that other people know, but I'm hurting and I need help. And so they're starting to create those spaces for themselves. And I think that is something that we can, focus on. And I know that sometimes a lot of the conversations with men is about managing your anger. And I think that is a problematic conversation to have. Because we need to talk about why are you angry? And not when you are angry, what do you do? So a lot of times the conversation is don't hit, don't abuse, rather go and have a drink or, those kind of things. But what you want to know is why are you angry that your girlfriend didn't cook food for you? That's the conversation that we should be having. And that's when we really start dismantling these societal norms, patriarchal norms that we have. And so, we need to have some work that needs to be done with women as well, because women are patriarchs too, because the system won't survive unless those who are being oppressed helps it, you know. So yeah, I'm probably going to get into trouble for that.
Well, you know what they say, they call it good trouble. Um, so, I was also just wondering if we've done enough, and I guess we kind of know the answer, in terms of human beings doing things for incentives. I mean, we all do things because we get something out of it, whether it's pleasure or happiness or health or money or whatever. And I'm wondering, I'm reflecting actually on what a poor job collectively we've done on highlighting to men and boys just how damaging patriarchy is to them. I think the messaging, the narrative has really been, it's been women fighting against patriarchy because patriarchy is bad for women and queer folks. But I just feel that,
Yes.
we could perhaps do so much more in really just pointing out in very practical ways how harmful and toxic patriarchy is to men. But I really appreciate those reflections. Thank you. I wanted to move on now and just speak a bit about your interactions, experiences with the Solidarity Fund. So we know the Solidarity Fund has positioned itself, certainly in recent months, as this conduit and pot of additional resources, specifically around GBV. We had them on one of our weekly conversations in the early days where there was a lot of talk about all the work they were doing, but we just never saw this, manifesting. And so we got Wendy Klo on, and she came, and we basically had an open dialogue where we actually discussed what were they doing, why were they doing it, how did they allocate that initial, I think it was 16 million rands, I speak under correction, how did they allocate that initial amount? And she went to great lengths to explain how it went to the GBV command center, laptops and SIM cards for people to work at home so that command center can continue its work. I think she spoke about some of the money going to Tutuzelas, et cetera, et cetera. And we've seen also a lot of social media influencers actually promoting the Solidarity Fund and its recent call for small grants for GBV on social media in the last few weeks. What has Rise Up's experience been, if any, with interacting with the Solidarity Fund to further support the work that you do?
We haven't had any direct interaction with the Solidarity Fund. We saw the calls for funding, etc., etc. But I think for us, it was more a question, or the conversation is more around how do these funders fund, and what do they fund, and what is the ways in which that funding gets released. And for instance, one of the problems that we had, we got some funding to provide food aid, direct food aid, and health services to undocumented migrants in the CBD. The funder wanted all sorts of proof, etc., etc., etc. They were insisting on registers, etc., etc. When we did the distribution, some of the funder staff was there, and they actually saw how dangerous it was, the requirements that they had, sort of put out, particularly around the registers. And so I think it's a broader question that must be had, not just around Solidarity Fund, but around funders in general, in terms of how they fund organizations such as ourselves and other organizations as well. RISE did not apply for funding from Solidarity Fund. Also, some of the funders, I'm not going to mention any names, but you honestly feel like they want blood, sweat, tears, DNA, pee samples, and the list just goes on and on and on. And it makes it, the process, the administrative processes are so onerous, particularly for smaller grassroots organizations who really, 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 really need the help. And so I think it's because we haven't had engagement with Solidarity Funds. So I can't really speak to the funding in particular. But, so for instance, something like court support. there's not a lot of funding for that. And that is it's a really long process. People need all sorts of support when they go through the criminal justice system trying to get justice. And so when it's big cases, yay, then everybody is out there on the day. But there's 20 court appearances, it keeps being postponed, or it can drag on for years, and you find that along the way, because people can't support. I need to take off work to be at court all day to support a survivor, and who's going to pay my salary, etc., etc. And so organizations like that need a particular focus when they are provided with funding, because how do I account for the kind of support that I'm giving, which actually costs money? And so I think during COVID, because we had discussions with some funders, I think during COVID, a lot of funders were trying to look at themselves in terms of how do we change to accommodate organizations. And I hope that there'll be changes, but one never knows. So
Yeah.
I'm not even sure of, I don't know of any organizations yet that, that have informed us that they did get funding from Solidarity Fund and how that. But I do know for the first one that closed, I think on the 18th of November or something, it was quite an easy process. It was like a 2-page or something, but it wasn't a lot of money. But it was like a 2-pager that you had to complete, etc., etc. So I think that maybe they are trying to, make it a little bit easier.
Yeah, yeah. Thanks for that really valuable contributions. And I think solidarity is coming under increasing spotlight, as a huge pool of money, multi-billion rand pool of money, and how that is split to cover the various issues being affected by COVID. But I can see we're approaching the top of the hour. So I just wanted to get your
Really?
reflections on, yeah, time flies when you're having fun. So 2021, COVID vaccine is arriving. General public, you're increasingly hearing, the phrases back to normal, back to normal. We know that when the vaccine comes, not everyone is going to get it, at least not next year, but it'll be those over 65, those with comorbidities, and those who are healthcare workers who will get the first batches of the vaccine in 2021. Um, what is in store for Rise Up? How has COVID perhaps forced you to rethink your programming and approaches, if it has at all? What is in store for 2021 when it comes to continuing the progressive work you are doing in GBV, but now in the context of yet another pandemic, which is COVID?
Yeah. So for Rise, we've actually added services, like we didn't have enough work. So the evacuation service is now going to be an actual service that we provide. So we've gone out and actually tried to, actively trying to get funding for that, because there's quite a bit of work that needs to be done around that particular service, especially around safety, etc., because it is very dangerous. I mean, early on in lockdown, there was a SAPS official that was killed in Sandton when they responded to a domestic violence call out. And so for RISE for 2021, we're definitely going to be honing our evacuation service, and we're trying to start rolling it out in other provinces as well. So we're looking for partners to do that work, and then we're trying to do quite a bit more work with our demographic. And actually we have what we call our dignity village, or village of dignity, that we're trying to create around the women and GNC folks. Because one of the things that people don't understand about this particular demographic is nothing is easy. When you say get a job, okay, I don't have an ID, number one. Number two, I don't have a cell phone, so nobody can contact me. I don't have an address. So, so how would you like me to get a job? I'm dirty. I can't, I haven't been able to get a haircut. I can't, go to the hairdresser and do my hair and look presentable to walk in and, have an interview, and how do people contact me, etc. So nothing is easy. And so this village of dignity that we're trying to create around this particular demographic looks at dealing with all of those aspects, from, you know, making sure that they have the correct documentation, to rehab facilities and services and counseling, because living on the street is hard, and you are not going to be able to do that without some sort of drugs or alcohol or some substance that's going to numb you to your circumstances. And so the village of dignity is really looking at all of that. And so this is our, you know, our strategic vision for the next 3 to 5 years, to create that village of dignity. We've already started. We've got some funding for a program to run in KZN and in Gauteng, just a small part of the village that we're creating. But we're hoping that we're going to be able to actually develop a plan that other organizations, other countries can also implement, and it actually works. And so, yeah, we're going to be focusing for 2021. As it relates to COVID, I mean, we've added services, like I said. But for the most part, our work itself hasn't changed that much, because we are able to do quite a bit of work from home, etc. So we're not, you know, we weren't too touched or affected by that. And it's just trying to make sure that we keep doing what we are doing, and trying to do it better. And hopefully, I don't know, I have a particular problem with this returning back to normal, because normal wasn't that great to start with. And so, you know, I'm a bit concerned about that. But I also know that people are tired. I mean, I'm tired. People are just tired. We're tired of COVID. We're tired of people dying. We're tired of not living full lives, you know, because even though I don't really spend that much time with other people, the fact that I could not spend any time with anybody, like, really affected me. I was like, oh my word, I always thought I was some sort of recluse. And now I realize I actually do like spending time with other people. And so it's really made us think as, or I hope as people and as society, in terms of what is the value of these relationships that we develop, whether they be platonic or not. Work relationships, you know, what does work look like now these days, and what is it supposed to look like? And I'm glad that, because I've always been a proponent for flexible working and working from home and all of those things. I'm glad that one of the things that the pandemic has done has actually shown organizations that this is a possibility if you give people the tools, that they are able to do that and can still be productive, and even more so than, you know, sitting 2 hours in traffic and then getting to your office and spending 8 hours there and then sitting another 2 hours in traffic to get home. So yeah, I'm hoping that, you know, we'll return to some sort of life where we can live it a bit more fuller. So I don't want normal, because normal wasn't that great. And we really need to look at how do we change our society. But it's, you know, I don't think that there's much political will for that to happen.
Yeah, absolutely. I mean, I like what you say about nothing is ever easy. And of course, because we live in hope, we add on that hopefully it will be worth it at some stage. Um, but yes, Vanita Daniels, a comrade, a warrior, an activist, a revolutionary, a forward thinker, a barrier breaker, and of course, one of the directors of Rise Up. Thank you so much for joining us. It was an absolute pleasure speaking with you. And we wish Rise Up all the best going into 2021. And just thank you for the work and the energy that you do, and your focus and your tenacity and your bravery in this space that we call our sector and our world in general.
Yeah, no, thank you so much for having me, us, Rise Up. We really appreciate the support and the love that we get in the sector, because honestly, we can't do the things that we do without help that we get from so many organizations like the National Shelter Movement, call to action. You know, there's so many organizations. I don't want to name anyone because I'm going to miss so many, but we can't do what we do without others. And so I think for me, the thing that I hope for more than anything else, as we start, you know, getting used to living the way that we have to live, is that we realize how much we need each other, and that we keep doing that, helping each other, working together, because together we can achieve so much more. So I really appreciate, you know, you guys having this conversation with us, featuring us, and thank you so much for the good wishes. We're gonna need it for 2021 and beyond.
Absolutely. Thank you again so much, Vanita. Have a wonderful Thursday, and our regards to everyone at Rise Up.
Thank you so much. Take care. Bye.
Bye.
Bye, Vivian.
Bye, Vanessa. I'll call you later.
Okay, thanks. Bye.
Bye.